Major cuts to Idaho Medicaid are impacting healthcare across the state, including funding for the Assertive Community Treatment Program, or ACT. Behavioral health providers in the state are now concerned that vulnerable people will be left without proper health care. Assertive Community Treatment, or the ACT program, is meant to help those in the community with severe and persistent mental illness. The Idaho Department of Health and Welfare says ACT teams strive to function as a psychiatric hospital without walls, helping people maintain recovery in the community and reduce psychiatric hospital and jail stays.
It's a program where we send out counselors, we send out nurses, we send out employment specialists and substance abuse specialists, peer specialists, and prescribers to make sure that people who are at the highest risk in our community are getting the mental health care that they're needing. Many are coming out of jail, many are coming out of hospital. And what we do is we make sure that they are connected with whatever level of services they can handle.
ACT operates in a way different from most treatments, as it serves those that may have schizophrenia, bipolar, or major depressive disorder that aren't as successful in traditional mental health treatment.
This isn't the typical mental health population.
Since last year, the program has been administered by Magellan Health Services as part of the Idaho Behavioral Health Plan. But after state funding cuts to Medicaid, Magellan announced to behavioral health care providers last week that funding for ACT would be getting cut as well, effective December 1st. Providers like Rick Boyce of mental health specialists in Pocatello are highly concerned about what this means for a vulnerable population.
This is a critical piece of the state's infrastructure that is getting cut away with no oversight and being done at breakneck speed. If I would rate this as the very, very last mental health service that should ever get cut.
Legislators reached out to providers this weekend, attempting to clarify that the ACT program is not being cut itself, but that funding cuts will cause it to be restructured into a fee-for-service model. Boyce and other providers maintain that only 2 of the original 20 services provided by ACT will remain in place, leaving only in-office counseling and medication for those in the program, effectively rendering ACT non-existent. With only weeks before the decision takes effect and without an adequate contingency, providers are worried for the safety of those in the program as well as the public.
And every time we ever hear that there is a school shooting or some kind of mental health incident, we hear, oh, more needs to be done on the mental health end of things. This is the one service that is able to provide the aggressive outreach to all aspects of the community.
The Idaho Department of Health and Welfare is hosting an in-person listening session tomorrow at Idaho State University. It will be held in the Wood River Room. Medicaid members will be able to provide feedback from 2 to 4 p.m., and Medicaid providers will be able to provide their feedback from 5:30 p.m. to 7:30 p.m.